Hello, and welcome to the presentation of Advanced Life-Saving Interventions. This is going to be a presentation about a simulation for students to use to further their nursing education. We'll start off with why use this simulation and who is it going to be for. It is set up for undergraduate nursing students acting as if they are ACLS certified. So they'll be students towards the end of their undergraduate degree. They'll already have a good wealth of knowledge under them. So it'll be a good simulation to test some critical care or critical thinking skills as far as this simulation goes. The simulation, like I said, will facilitate critical thinking to help them learn what to do in a situation such as a patient becoming pulseless. Oftentimes that can be a little hectic for anybody that is new to a situation like that. This will kind of help in some ways just kind of get their feet wet and to knowing what to expect in these situations. Learning objectives for the simulation will be identifying different cardiac rhythms on the monitor. They'll be in the ICU is the setting, so they'll be hooked up to a monitor. Another thing we'll focus on is managing care of the patient during CPR, making sure that all the proper techniques are used, and also utilizing the correct medications at the appropriate times during CPR. This would include epinephrine. Sometimes it could include atropine, but those will be the focus, mainly epinephrine during this simulation. Pre-simulation assignment, I will have each student fill out just a basic rhythm quiz. It's not going to be anything too in-depth. It'll basically have all your major rhythms to identify, such as VTAC or asystole or normal sinus rhythm. The quiz has no weight on whether the simulation is passed or failed, and the answers will be discussed during debriefing. That'll give them the chance to see the rhythms in action in the simulation, and then we'll have a chance to go over them during debriefing. Like I said earlier, the patient is in an ICU setting. The students are acting as if they're nurses on a routine hourly round, just coming in to see the patient. As I stated before, also, he will be on a monitor. It'll have a one lead EKG up there, which can be changed between leads. It'll also have the patient's pulse ox and blood pressure being monitored. There will be a crash cart in the room, in the corner of the room, for when it is needed to be utilized. The patient will also have a wife in the room. She'll be an embedded simulation person. We'll get into her a little later. And also in the room will be just routine hospital items such as gloves, a bedside table, things like that. Pre-briefing will consist of just a general overview, such as the students are going to be going into a room. There's going to be a wife. They get the background that he is in his 50s and he is admitted for syncope. I will also state in pre-briefing the UAB School of Nursing basic assumption, which is we believe that everyone participating in activities at the UAB School of Nursing is intelligent, capable, cares about doing their best, and wants to improve. Do this to let the students know that we do realize that it is It is a simulation and it's not the real deal, but we do try to make it as real as possible. And also during pre-briefing, I want to just set up a environment that really allows the students to feel like they can go out on a limb and learn and try some different things, because learning can take place during mistakes or the right thing. So just would encourage the students to approach the situation as they normally would, and getting an answer wrong will not affect them in any way. We'll just discuss it and post and debrief them. The scenario starts out with the students walking into the room. The patient will be sitting in bed. He'll be feeling fine. The wife will also be there. She'll be calm at this moment. Nothing really going on. The patient, a few minutes in, will then start to say that he begins to feel dizzy. At that point, the rhythm will change to VTAC on the monitor. He will have a pulse. He will still be talking. And at this point, the students can try a few different things as far as vagal maneuvers or things like that to try to get him out of VTAC, but inevitably he will go into VTAC without a pulse. At that point, the students would need to start CPR. In the VTAC phase, they will need to give epinephrine every 3 to 5 minutes, and as well as defibrillate as long as he's in VTAC. He will go in through VTAC for a few minutes, and then he will move into PEA. He won't have a pulse, but he will have a rhythm. The students should pick up on this, and then they will just continue CPR and epinephrine. And depending on the progress of the students or how they do, the patient will either come back to a normal sinus rhythm with good blood pressure, everything, or he will come back to a bradycardia rhythm with some low blood pressure if they could have done something a little better. And at that point, the scenario will be ended. During debriefing, we're going to use advocacy and inquiry. I feel that the advocacy inquiry really fits this simulation due to its nature and being able to go back and look at specific things that happened during the simulation, providing a little feedback, and then asking them a question regarding that. I feel that will be one of the better ways to debrief this particular simulation. Asking a lot of open-ended questions, try to get some good conversation on the end of the simulation. And during this time, we'll also go over the quiz answers so they can relate to what they saw in the simulation. The embedded simulation person is going to be his wife. She has a role set up to where she will start out calm, and then as he declines, become more and more agitated to the point where she is angry at the nurses for doing this to him. And after a short time of that, she will step back if the nursing students ask her to step back. If they don't ask her to step back, she has instructions just to stay there until someone intervenes, but at which time she will step back and let the students progress. That's basically the simulation in a nutshell. I will say that a simulation like this is necessary for anybody in nursing school. It'll help to open up to the possibility of a patient becoming pulseless, and just the general what to do if they don't take anything away but besides CPR during this simulation, then that's okay with me. As long as they start CPR, they'll get the rest as their nursing career continues. But it just gives them an opportunity to come in and see a situation like this. It also gives us a little light as to how their nursing program has been going so far as well. It's a real good way to gauge what all they have learned this far in the nursing program. A situation where someone becomes pulseless definitely uses a lot of different systems that have been covered by the nursing school program, and this gives us a way to see how it has been received by the students. I appreciate you for your time, and I hope you enjoyed the presentation on the simulation. Thank you.